research-wise, what we are trying to do is thinking through different projects is actually to gain some clarity about what therapists are actually experiencing in therapy, and especially when those like what we call existential concerns come up during therapy, when clients speak about it, or when there is like a clear existential situation, such as group therapy with cancer patients or with prisoners. And I think this is like the starting point, like what do therapists experience actually? How do they respond, or how do they not respond, or what happens? And we have like some very interesting studies running, and they all point at the fact that it's not easy for therapists when clients bring really like those existential characteristics of their living process, such as meaninglessness, or like finiteness, or like real like deep existential isolation, because that's the interaction first.
Yes.
You cannot, as other human being, or at least with two human beings in the same room, and what the client is talking about actually is also a lot about yourself, because you're also dying at some point, and you're also often feel maybe misunderstood or not completely understood, or you feel isolated maybe and there's probably also a lot of meaninglessness in your life, and that's also a challenge. And we see that many therapists, like, they give different reactions, but they often retreat or close, or do things in order not to be with those moments in therapy, with those existential moments.
Yeah, I would entirely agree with you. I mean, even in my own practice, depends on the client, depends on my relationship with the client, but certainly some of those issues at this point in my life, at this age, I can feel in me that it touches a shakiness. And then I have a choice. Do I take a step into that and share it and make it a shared exploration that we both are living with? Or do I take a step back and interpret the client, or make them focus, or do something that keeps them away from me?
Yes. And that's exactly what we are seeing. And that's also what I recognize myself as a therapist, right? Because it's like there is that moment of choice. Or, I mean, when you're aware of it. Right? It's like, okay, this is close, or wow, there's so much meaninglessness. How on earth will we get out of this? Maybe not, and that anxiety around it, or feeling overwhelmed by it. And so it seems like, I mean, that's what I recognize, what you recognize, that therapists do a lot of work, or, they try to do something in order maybe to regulate their own experiences, which is, of course, we think is not very helpful. And actually was, I think, Gendlin who was talking about this, like, at least you try to be there with your client, and don't use focusing as an instrument to go away from your clients or from those topics. And also Rogers was talking about those things. And maybe, I don't know, maybe because we became better and better in doing things, also experientially, like there's a lot of experiential methods to use these days. I sometimes wonder if that's sometimes a way of experiential avoidance almost. Of course, I myself, I do a lot of focusing. I also learned a lot from emotion focused therapy. I use chair work now and then, when I think it's interesting, like empty chair work, because sometimes we don't need to talk about that, but it's sometimes easier almost for a client to do that in a different chair. but of course, why do you use it? Like, what's yeah, do you use it as because you feel like this will help us to get closer or to be with what's happening, or do we use it in order to do something because I
Yeah.
feel panic?
Why are you using
Uh,
it in that particular
yes,
moment?
yes, exactly.
Why do you think it is that in our work, when those moments are touched that are shared, um, what are we afraid of?
Good
Like,
question.
why don't we open up and just sort of say, "Oh yeah, God, I know exactly what you're talking about. I can really
Right.
feel it."
I think probably there's so many reasons. There's so many reasons. There's a lot of personal vulnerability, I think. So
Mhm,
it maybe also depends on the therapeutic relationship. That could be a possibility. But it's also, I think for many therapists, that's what they say. It's like very overwhelming, and they feel like suddenly there are existential questions they didn't expect there to be, and they
mhm,
have to, they really have to think about those existential themes, and maybe they don't want to.
mhm.
Um, maybe also, I think there is also a shift in relationship. You know, you're not a that maybe you're more a human being or a fellow traveler than like a specialist expert therapist who will solve the problem, so to speak. Um, yeah,
So part of the overwhelm is
I
how
think
they
so.
think they should be as a therapist.
Yes, yes, yeah. What do you think, Greg? What are your thoughts?
Um, I think I guess the thought that was going through my mind as I was listening to you is would we feel as overwhelmed if we were talking to a friend about that?
Right,
Someone where it was a much more mutual relationship, it's not a professional relationship.
right,
So is part of the overwhelm our trying to maintain some kind of a professional stance the way we interpret it, and we're worried that if we share and are too mutual, that what are they paying us for then?
yes. What that reminds me that a lot of therapists, and I think also myself at some points, feel powerless.
Mm-hmm.
So, and maybe that is a little bit aligned to what you're saying, like you're supposed to be the person who is helpful, and you feel like you cannot be of help, or you cannot solve
Yeah, yeah,
the
yeah.
client's existential fear or their loneliness or the fact that they will die,
Mm-hmm.
or um, and that you will die too, you know, and yeah, it's can feel really overwhelming. It can really
Mm-hmm.
feel powerless, and that might be feel a hard thing as a therapist. Yeah,
Yeah,
yeah.
yeah. I mean, even I remember in conversations with Gendlin, when we would talk about these things, we would notice how in the talking about it, we are already evoking it.
Mhm.
And I'm feeling that a little bit now, that I'm on the edge of feeling the reality of what you're saying rather than it just being a discussion. It's like, oh my
Right.
God, this is actually real.
This is real. This is real. You know what I recently, or maybe it's a year ago, what's recent, I reread the Rogers Buber dialogue. And Rogers is pointing out that actually the like empathy and authenticity, etc., is actually only a help to um, come to those moments that we have those existential meetings with our clients. And for Rogers, he says that's is actually the moment of change, so to speak. Um, so I think that's really interesting because Rogers is always, portrayed as a guy with, about empathy and about
Mhm,
congruence and
mhm.
positive regard. But he says, well, it's actually only a stepping stone towards those moments of deep meeting.
Yeah.
And then, yeah, that's what we sense, um, right? When we are not only talking about it anymore, but also experience it. And I think as a therapist, it gets really close. It's really different to also be in the here and now with the client's past or with the client's issues with their spouse or friends or with work or with a certain disease, because there's still something of that distance, but the distance seems to shrink between me and the client, between us and what we are talking about. And yeah, so we started to call that, to give it a different name, existential empathy, like the ability to be there at those very moments. And it's only a couple of weeks ago that I discovered that Gary Prouty was a student of Gendlin.
Yeah, I heard you say that.
Yeah, was actually already talking about, like, he was talking about existential empathy and the capacity to be there at those very moments that you're just there as a human being with your client.
For me, if it's a description of the kind of meeting we were just talking about, I would want to add another word to that description. Good. I would want to call it mutual existential empathy.
Yes, yes.
Because for me, the experience is really, in that moment of meeting, it's like a larger space opens that includes the two of us and all of life.
Yes, all of life. I think that's true. It's not just the two of us, but it's all of life.
Yeah.
And again, you know, what's fascinating about Otto Rank, sorry for making those jumps, but he's actually also talking about empathy and about the therapeutic relationship, but he says it's actually about those moments that we experience existence, that we experience, he says, das Ganze, the whole, that we are in the whole together. Yeah, the entirety of the life. Yes.
That he says that that's like a therapeutic kind of moment.
Yes.
Or
Yes. Yeah. That's the moment of, I don't know if the word change actually applies, but that's those moments that I think also for clients and also for us as therapists are very precious.
Yeah, maybe it's the change that comes from that more radical kind of openness.
Yes, exactly. Yeah. I think that's also what Mick Cooper describes as a relation of that. That's probably also describing the same moment, or other therapists or scholars have also been describing those moments, like moments of meeting or you know.
Yeah.